guys, and welcome back to my channel. My name is Hannah and I'm a sexual health nurse. Please don't forget to like and subscribe for more things sexual health, contraception and relationship advice. Okay, so let's get started. Today we're going to talk about 5 common myths of emergency contraception. Okay, so for those of you who don't know, emergency contraception is taken after you've had sex if you're concerned there's a risk of pregnancy. So the first myth we're going to talk about is that there's only one type of emergency contraception. So this isn't correct at all. There's a few different types. There's a couple of tablets that you can take orally by mouth. They're pills. You take one pill and that's all you do in terms of emergency contraception. There's also an IUD, also known as a copper coil. Oral emergency contraception, so a tablet that's taken by mouth, works at delaying you from releasing an egg, so delaying you from ovulating. Obviously, if there's no egg to be fertilized, then there's no chance of pregnancy. The copper coil works slightly differently. So this is the coil that's inserted into the uterus, also known as the intrauterine device. If you don't know much about the copper coil or the hormonal coil, then feel free to look at my other video about the different types of coils there are. For emergency contraception, a copper coil is used. It is toxic to egg and sperm. So what it does is it aims at killing sperm before it comes into contact with an egg. It also disrupts the lining of the uterus, which means that if already an egg has become fertilized, it will prevent it from embedding into the uterus to form a pregnancy. Now, a pregnancy, there's debate as to when a pregnancy starts, but legally in the UK, it is at implantation. So if we can prevent a fertilized egg from implanting into the uterus, it's preventing pregnancy. So leading on to that, it always works. This is a big myth. If you're taking oral emergency contraception, for example, Ella-1, this needs to be taken before you ovulate. Most people, if you have a 28-day cycle, you will ovulate around day 14. If you have a 30-day cycle, you'll ovulate around day 16. Basically, you take the length of your cycle and minus 14. This is the day that we presume you might be, or you're most likely to be ovulating. If you are before this time or around this time, it's a really good time to take emergency contraception because we'd be delaying you from ovulating. If you're after this, then taking oral emergency contraception is going to do most likely absolutely nothing. This leads on to my third point, is that emergency contraception is only for the day after, which is completely incorrect, which is why the term morning after pill is not the best term to use. Emergency contraception is better. So with one of the pills, it can be used up to 72 hours after. And another pill, for example, Ella-1, can be used up to 120 hours after. So approximately 5 days after the risky sex that you're concerned about. The copper coil can be fitted up until 5 days after ovulation. So, for example, up to day 19 of your cycle, which will, like I said, protect you from any sex that cycle. If there's a risk of pregnancy after this, then we can fit it within 5 days of the sex, as long as you haven't had any other unprotected sex that cycle, because there could be a risk of pregnancy. Now, on to my fourth point. Emergency contraception is extremely expensive. If you go to a pharmacy and buy it over the counter, then you could be paying £35 for an oral tablet. If you come to a sexual health clinic, no matter your age, you are entitled and allowed emergency contraception, whether it's a coil fit or a tablet, at any time, and it's completely free. So please, if you're struggling with finances or if you just don't want to pay that amount of money, come to a sexual health clinic and you will get it for free. It does not cost anything. Pharmacies, I think, also do it for under 25s, and it's free as well. So if you don't want to come to a sexual health clinic, then you can pop to your local pharmacy and get emergency contraception for free. Obviously, people that are over the age of 25, you then have to pay for it. So a sexual health clinic may be a better option for you if finances are slightly tight. Final point, emergency contraception causes abortion. This is completely incorrect. So like I said, the ways that emergency contraception work are by delaying ovulation or preventing implantation. A pregnancy is counted as a pregnancy once it has implanted into the uterus. If it has not yet implanted into the uterus, or the egg hasn't even been fertilized, because the way oral contraception is working, the egg and the sperm haven't even met, so there's not even a pregnancy possible. It's just not true, guys. It's just not true. And people that are telling you that it causes an abortion, it's not correct at all. Sexual health clinics, definitely the one that I work at, we're not licensed to perform terminations, and we would refer you or get you to self-refer to a termination service if you were already pregnant. Adding on to that, actually, oral emergency contraception does not affect pregnancy. So if you were pregnant from previous sex and you took emergency contraception, then it's not going to harm pregnancy. With all emergency contraception, it's not fail-safe. There is still a risk of pregnancy, so we'd advise for you to pregnancy test 3 weeks after taking your emergency contraception. I will do a video in a few weeks' time on the different types of emergency contraception, discussing when you take them, what the side effects are, and how reliable they are, just so you've got a little bit more information. But I hope this helps cut out a few of those myths that people may have told you or that you may have heard. Thanks so much for watching, guys. Don't forget to like and subscribe for further sexual health, contraception and relationship advice from a sexual health nurse. Take care, guys. Bye-bye.